Community Services Society is a charitable non-profit on Vancouver's downtown, inside and in Victoria. We provide over 1,500 units of supportive housing, harm reductive and overdose prevention to those underserved to our community. Our mission, PHS Community Services Society provides compassionate, dignified housing and services to those who are poorly served as well as in the community due to their physical health, mental health, behavioral issues, substance use, forensic history, and for those who are homeless.
Today I would like to present about the PHS management team and board of directors. So for the management team, the CEO named Michael Vaughn, and for the COO named Kim Hiebert. For the directors, there are 5 people. The first one named Tanya Feder as Director of Housing. The second one is Devinder Sekhon as Senior Director of Finance, Social Enterprise and Administration. The third one is Susan Alexman as Director of Programs. The fourth one is Anastasia Humanok as Director of Human Resources. And the last one is Dr. Christy Sutherland as Medical Director. For the Senior Management, the first one is Coco Culbertson as Senior Manager of Programs. The second one is Scott Douglas as Technical Services. The third one is Duncan Hagon as Senior Manager of Housing, Temporary Modular Housing Lead. The fourth one is Marina Jans as Interim Senior Manager of Housing. The fifth one is Darwin Fisher as Senior Manager of Programs. The sixth one is Shelley Bolton as Senior Manager of Social Enterprise. The seventh one is Pong Lam as Senior Maintenance Lead. The eighth one is Ras Maynard as Community Engagement Lead. And the last one is Avery Taylor as Senior Manager of Housing and Housing Support Services Victoria.
And I'm going to tell you one of the community activity that PHS provide, which is housing. Every night, PHS provide homes and shelters for thousands of community members, whether it is in emergency shelter bed, converted hotels and homes, or purpose-built social housing buildings. Today, PHS operates 14 housing projects and over 1,500 rental housing units in Vancouver and Victoria. An example of the housing projects are Alexander Street Community, Rainier Hotel, Beacon Hotel, and many more. So now I'm going to tell you one of the housing project, which is the New Fountain Shelter. The New Fountain Shelter opens nightly from 7 p.m. until 9 a.m. and they will provide 60 spaces for shelter nightly for homeless individuals who are often rejected elsewhere, whether it is because they are actively addicted, have pets, have cars, or belongings that require storage, or fare poorly in institutional settings. This shelter guest will also provide it with a hot dinner, warm breakfast, and a packed lunch. PHS also provides active outreach work for shelter guests pursuing stabilization steps that includes seeking identifications, obtaining social assistance, receiving medical support, or finding new housing.
But I'm going to explain about one of the PHS core community activities, which is the services. The services offered by PHS are focused on the resident and their specialized need. The aim of their services are to develop flexible, relevant, and effective services for the people in the community that they care about. There are about 21 numbers of services that developed by PHS in response to the urgent and unmet needs of the people in the community. because 21 numbers of services are quite a lot of number. So I'm just going to explain and share two examples of the services by PHS. The first example is the Downtown Eastside Central Kitchen. It is a non-profit food preparation and delivery service operated by PHS. It is dedicated to combating malnutrition among low-income people. The residents of PHS operated housing project will receive 1 or 3 hot meals a day. In this service, they also provide part-time supported position for local residents. Second example is the PHS Primary Care Clinic. With its multidisciplinary teams of physicians, specialists, nurses, and social workers, the clinic offers comprehensive primary care, mental health, and addiction treatment services. They also offer monthly internal medicine, gynecology, and women's health clinic.
Assalamualaikum. My name is Zoratasha binti Khairi, metric number 1716556. So moving on to PHS advocacy sector. So first thing first, we have to know the fact that PHS, being the frontliner of a PHS member is not as easy as it sounds, because being a PHS frontliner, it means that you have to witness a brutal degree of suffering, discrimination, and dehumanization. When I say this, it means that you have to witness decent and kind human beings became sick and were treated abhorrently and died. So on these occasions, there was no public outcry, or there is no actions from the government to curb this issue. Therefore, this is where PHS came into the picture. So among all the campaigns that PHS had worked on throughout these years is like culture saves lives. It means through this culture saves life campaign, they organized campaigns that unites people, and then through that campaigns they have like smaller programs that advocate on the issue and awareness of HIV patients and AIDS and stuff like that. And then other than that, they also have a pigeon park savings. So under this pigeon park savings, it's not just a bank where it helps people, but also they provide advocacy on financial literacy. For example, they help the low threshold strategy encourages savings, promotes financial responsibility, and even foster a sense of citizenship within their community, for like to help each other in stabilizing their economic and their finances. And other than that, residents can be in control of their finances, receive advices from them, and take steps to become financially stable without depending on loan sharks or lenders. And through this pigeon park savings, they have overcome this barrier for over 4,000 disadvantaged people in Canada. And then moving on to the second campaign that they have, which is Insight Demonstration. So Insight Demonstration is actually where they hosted a free conference on Oppenheimer Park, which called Out of Harm's Way. So this campaign was specifically made to cater to the issue of drug users. So in 1997, the PH has hosted a free conference on the drug abuse, and 2003 PHS set up a health quest, which which Canadian can come there and just to have their health screening for HIV and AIDS. But unfortunately, in 2006, there was attempt of closure of Insight due to political pressure in Vancouver. And then the case went on until 2011, where all the 9 judges of Canadian highest court ruled that unanimously that attempts by the federal health minister to close Insight campaign went against the country's Charter of Rights and Freedoms. So therefore, until now, Insight is still operating as usual, and lots of the Community Services Society collaborated with other organizations in Canada itself. And then moving on to the last one, which is what's your status campaign, which is the main campaign that under PHS advocacy, which they help to cater and to operate free health screening like the first one, but this one is to cater and to see what's the status of drug user in Canada. Therefore, in conclusion, we can see that PHS in Canada really have set a good example for the world to follow in serving the community, because the PHS has always tried to represent the needs of people in the community who are underserved, unseen, and who have too frequently being unheard, and immersed in the suffering and in relationships with hundreds of the most marginalized people in the community. Therefore, let's do community service. Thank you.